All right, I see that I am live. I am using my Domino Effect Health YouTube platform, which I am not accustomed to using, but everybody is going virtual, so I need to expand what I already do virtually. I am a licensed health insurance, both life and health. I've been licensed since 2014, and I cover all aspects of the health insurance industry, from a short-term medical to the ACA Marketplace Plan and all the little coverage type availabilities in between. So the reason why I am posting this really is for my personal ACA Marketplace, excuse me, I have an itch, Marketplace policyholders. ACA Marketplace, previously known as Obamacare, has just completed their open enrollment. And if you've ever gone through the process, you know that the biggest component is what is your income in the next year. So we did open enrollment in 2019 with the 2020 enrollment or income. So a lot of my clients had to guess at what their income is going to be. Now our W-2s who have a regular paycheck coming in, it's much easier for them to predict unless you've experienced what we're going through right now with this social distancing. A lot of businesses are shutting down and we don't know when we're coming back. And then our economy is going to be affected. Even when it's time to come back, will people be able to afford to come back? So there is a lot of unknowns what's going to happen. So this conversation is specifically for my ACA Marketplace, whose price of coverage is determined by their annual income for the year 2020. We are only in March. We have no way of knowing now what is our income going to be because of the way everybody around the world is now on hold. Our businesses have been affected, our paychecks have been affected, our income has been affected. So the first thing that I need every one of you to do, go look at your original emails. You want to find your letter of eligibility from the marketplace, HEALTHCARE.GOV. It will have come to you at the time of application when you first put in your application and described what your income is going to be. That is the annual income that you reported. Now, some people were at the very lowest level that could maintain a subsidy. When the numbers first come in available to, yay, you get a subsidy lowering your cost. Now, what you may not understand is there's what I call a donut hole for those people who make less money. We're not making a lot of money. People who are making less money. In general terms, $15,000 annual is often that cutoff point. And if you make less than that, and again, that's a general number, it's very specific to what your income is and how many people are in your family and where you live. But if you make less than that, you likely will not qualify for subsidies. And if you're on a marketplace plan thinking you have subsidies and your income drops below that minimum level, you now are going to owe full cost on the marketplace. So if you thought you were paying $300 a month and your income drops below that number, which is the minimum income according to your household size and location, you may owe the full amount. So how does that affect you? Right now, you are set up, I'm giving that example of a $300 per month, and we're going to say that that person's, and I'm just random numbers, $300 per month, and they are normally at $635. So this person is saving $335 because of their subsidies. Now, we've been on this plan for 3 months now. If you're not paying attention to your income and you ignore your ACA Marketplace and you continue to pay your ACA Marketplace, And at the end of the year of 2020, you find out that your income fell below the minimum requirement, you're going to owe that money back because it's directly connected to your tax credits when you do your taxes the following year. So if my person right now is this close to that minimum level, and we know they're going to drop below because they just took a month off of work, it may behoove them to report a change of income on the marketplace. And they may need to reassess their ability to hold the coverage on an ACA Marketplace. Now, I am recording this on March 18th. The marketplace has not made any updates or announcements as to how it's going to handle this type of situation, but it's going to be widespread. So the information that's being shared today may change tomorrow. They may make a post saying, okay, if you fall into this donut hole level, we're going to make adjustments. But as we are talking today, it doesn't exist. So if you were to change your income because you know missing a month or more of work is going to drop you below that minimum level, you now owe the full amount on that coverage. So if you've paid for 3 months and your difference on savings was $335, we're going to multiply that times 3, and you will now owe $1,005 just for 3 months of coverage because you lost your subsidy because your income dropped below the minimum requirement. Now, this is not everybody. If your income drops, but you still are within subsidy requirements, then your subsidy is actually going to grow and you will have a larger subsidy and owe less on your insurance. This warning and alert is for those who are going to drop below the minimum in order to get a subsidy. Again, it is very individual. Your age, how many people are in your family, what is your annual income, and what is your zip code. These will all determine what that minimum income is going to be. I cannot tell you everybody falls under 15,000. It's just a general guideline. So if yours is going to drop below 15,000, you need to have a conversation with your agent and reassess if the marketplace is truly going to be the best place. I'm not saying jump on the bandwagon right now and drop your plan, because the ACA Marketplace can change everything overnight. And if you jump too soon, you may be out of luck. If you don't jump at all, you're going to be out of luck if you went below that minimum. They may be opening up a new enrollment period because of these changes. We don't know, but you need to be educated, understand what is there, and track it. Keep an eye on your income. Keep an eye on the reported income that you initially shared when you got your plan. And that's going to be in your letter of eligibility that you received from HEALTHCARE.GOV when you went through open enrollment, which would have happened between November 1st and December 15th. That email is in there somewhere. Just search it in your emails. Let's see. What else do we need to know? Now, if this does happen, that you've lost your income, there's starting to be talk about unemployment. Unemployment is a state-by-state guidelines, but I am reading from a New York Times article that was posted, I believe, was it yesterday? Do they have the date on here? March 17th. So yes, this was yesterday. And it says what you need to know about unemployment insurance. So these are those people who can go online and apply for unemployment. So our first paragraph here, as the coronavirus outbreak grinds America to a halt, many workers have already experienced sudden drops in income. If their paychecks haven't been wiped out entirely, unemployment insurance is a crucial safety net providing a temporary cash cushion. Again, this is from the New York Times yesterday online, March 17th, 2020, and it is written by Tara, T-A-R-A, Siegel, S-I-E-G-E-L, Bernard, B-E-R-N-A-R-D. I will reference this website in the comments on this post. So understand that the conversations about unemployment, requesting unemployment, putting in your applications, they've already begun. Lines have already started, depending on your state, depending on whether there are online applications, and it's only going to increase the longer we are out of work. This page, the article, is going to address what are the basics in regards to unemployment, regardless of coronavirus. How many hours do you need to work, or have you earned over the time span? Things like that that are just common. That's going to be shared. How long do benefits last? Those are going to share. It's benefits for 26 weeks. However, 5 states, Florida, Georgia, Kansas, Idaho, and North Carolina, have a sliding scale tied to unemployment levels. All of this information, again, in this article, what makes me eligible to file? This is going to be very important. You're going to want to watch and track your income so that you can work ahead. Perhaps this unemployment will keep you out of the donut hole, to where you will be able to retain your subsidies through your income. The people who had a higher income and are losing some income are less likely to fall into the donut hole. The lower your income, the less you have to lose to drop you into the donut hole. Again, talk to an ACA Marketplace agent to go over this. They can review this information with you. Again, the New York Times, can I apply even if I'm technically employed, is another question addressed. Can I apply if my pay has been reduced? This is where a lot of you sit right now. And it says probably every state has some kind of partial coverage that allows unemployment insurance to replace part of your pay if hours are reduced. But the amount replaced varies quite a bit by state. Who is left out? Roughly half the states do not cover part-time workers. So there's a few other little information tidbits here. Gig workers, those side jobs, our direct marketing people, our Ubers, our Lyfts, the DoorDash, and the food deliveries, these type of ones, these are gigs. They are unlikely to qualify because they're largely considered self-employed. So self-employed, we work under a totally different umbrella. It's much more difficult to go into that unemployment loss of income because our income is directly related to our ability to put in the effort for work to create our own income. What if I have several part-time jobs? That is also going to be addressed. Is there a waiting period? And I will read the first sentence here. There is usually a 1-week waiting period until benefits start, but many states already have waived it. New York, for example, said on its website that it was eliminating the 7-day waiting period for people who are out of work because of coronavirus closures or quarantines. You still need to allow some time for processing. How do I apply? There's a link here to the Department of Labor, and it has a list of all 50 states. I've been accepted, now what? It says you'll most likely need to recertify your benefits each week, but you should be able to do it online and over the phone. Now, I do know part of unemployment is the process of looking for employment. These gig jobs, these side jobs, these are going to start taking over in our economy right now. I also, as a self-employed life and health insurance agent, I also carry some gig jobs. So I can help you learn more about that. I have opportunities that are going to be extremely in need during this time that everyone is stepping back and losing income, looking for income, and being able to do it while you are at home. So I am available. My information will be posted in comments. This is my first live stream YouTube, so I need to double check and make sure that I am able to post that information as a comment. But know that it's there. please track your income. Find your original letter of eligibility, know what your annual income was, and know what the minimum level of income for the year 2020 that we do not know. We don't even know who's going back to work when. Know what that minimum is so that you can be prepared with the ACA Marketplace and be watching for announcements from HEALTHCARE.GOV, because I fully expect them to be announcing what are they going to be doing with so many losing their income. This is Dana with the Domino Effect Health. I am located in Seminole, Florida. However, I am licensed in 17 states, and I am a 100% virtual at-home worker. So if you would like more information about how to have a job, hold a job, even one that is a licensed and certified position, being able to work from home, or one of the small gigs that you can do on the side and still work from home, making a good income, let me know. Have a great day. Good luck to everybody. And I should be posting some more YouTube posts as we continue through this new change in our economy.